Good day, everyone. This is Dr. Nedun Defo on Nedu Speaks. So today I'm going to be discussing a topic that a lot of people seem to shy away from. Well, anyway, it is a taboo to discuss this in most religious settings, especially in the developing society. And this has made a lot of young people to make uninformed decisions that potentially ruin their lives. That being said, so today I'm going to be talking about contraceptives. Yes, I said it, contraceptives. I know when people hear contraceptives, the first thing that comes to their mind is birth control pills. Anyway, contraceptives are any device or method that enables you to have sex without getting pregnant. It could be method, device, anything, and enables you to have sex without getting pregnant. So there are three categories of contraceptives. We have the barrier method, the hormonal method, and the surgical method. I'm going to discuss these three for the purpose of this video anyway. So let's talk about the physical barrier method. An example of the physical barrier method is the condom. The condom is called the physical barrier method because it prevents the exchange of bodily fluid during intercourse. There are two forms of condom: the internal, which is the female condom, and the external condom. The condom not only prevents you from having babies, it also prevents you from getting STDs or STI. At least it limits the risk of being infected with STDs in perfect use. The second type is the hormonal method. So the hormonal method makes use of two basic principal hormone I'm going to mention. So they are the estrogen and the progesterone. The estrogen, what it does is that it prevents ovulation. It prevents the release of the egg from the ovary, thereby preventing fertilization from occurring. So if there is no egg, of course fertilization will not occur. On the other hand, the progesterone prevents the sperm from swimming to meet with the ovum. What it does is that it causes the thickening of the mucus in the cervix or in the uterine wall, thereby preventing the sperm from swimming through to meet with the egg. So on one hand, the estrogen prevents ovulation. On the other hand, the progesterone prevents the sperm from meeting with the egg. So it works both ways. That being said, there are three forms of hormonal contraceptives. You have the oral pill method, the internal contraceptives, and the transdermal contraceptives. The oral pill method, the oral contraceptives, is divided into two. You have the combination pill and the mini pill. The combination pill makes use of the two hormones, the estrogen and the progesterone combined, progestin. That's the synthetic form. And also the mini pill makes use of one hormone, the progestin. Moving forward, let's talk about the internal contraceptives. The internal contraceptives are actually devices inserted into the body of the female. So let's talk about the internal contraceptives. Example of the internal contraceptive is the IUD, intrauterine device. The intrauterine device is divided into two. You have the copper IUD and the hormonal IUD. The hormonal IUD makes use of the progestin. So what it does is that it causes the thickening of the mucus, thereby preventing the sperm from swimming to meet with the ovum. And for the copper IUD, it provokes inflammatory response. Actually, they pretty much do the same thing. It's just that one makes use of the progestin hormone. We also have the birth control ring, which is an example of the internal contraceptives. And actually, they are quite effective. They have over 90% effective when in perfect use. Okay, which leads us to the transdermal. The transdermal patch is actually placed on the skin, It's used for 3 weeks, consistently for 3 weeks, and is removed on the 4th week. It's actually quite effective like the others, but I want you to note that this hormonal contraceptive does not prevent the risk of getting infected with STDs or STI, sexually transmitted infections. It actually prevents pregnancy. So finally, we have the surgical method. There are 2 forms of surgical method. Number 1 is the vasectomy, and the second one is the tubectomy. The vasectomy is actually the removal of the vas deferens. Vas deferens is just like a tube that conveys mature sperm to the urethra. So when this is being removed, the sperm cannot flow out from the male organ to the female organ. This means that the male is permanently sterile if this method is being used. It's more actually a permanent method. Then for the woman is the tubectomy. Tubectomy is like the clipping of the fallopian tube, and this prevents the egg from traveling through the fallopian tube to the uterus, preventing fertilization or any form of implantation. That's all for today. This is Dr. Nedun Defo on Nedu Speaks. Please don't fail to subscribe to my YouTube channel, and please leave a comment below and tell me how you feel about this video. See you next time.